Breast reconstruction is an art. To make someone who's had a mastectomy and lost the volume of their breast and the shape of their breast, to make a breast from basically skin. There are different ways to reconstruct the breast, going from the simplest, which would be to have no reconstruction, which is generally not what we recommend, to an implant type reconstruction, and the most complicated would be using your own tissues for the reconstruction. But in that center category of using an implant to reconstruct your breast, we usually do it in a staged procedure. We are coordinating with the breast cancer surgeon and our patients a way to reconstruct a breast basically from skin. And that's what we do. Generally, we stage it with an expansion of the skin because the skin is quite delicate after having had a mastectomy, and we gradually stretch that skin so that we can then put in an implant as the volume for the breast, and then we take their fat, either from their hips or their abdomen, and we layer it over that final implant so it looks like the opposite side. It's basically painting on a canvas. You start with primer, and then you get the colors in and the shape and the shading. That's exactly what we're doing to reconstruct a breast.